Hi, my name is Jerrica Lyle. I'm a nurse practitioner here at Secours Suffolk Primary Care.
Hello, my name is Dr. Hesed Mugaisi. I'm a family medicine practitioner here at Suffolk Primary Care, and we are here to talk to you about immunizations, seeing that this is World Immunization Week.
So how do vaccines work? What is herd immunity?
Okay, and I'll answer that. Basically, vaccines train our bodies to fight against dangerous diseases that are caused by pathogens. Usually, a vaccine does contain a weakened or a dead pathogen or some of the antigens that are part of the pathogen. These are injected into the body, and then they trigger what we call an immune response, but they do not cause the disease. So once we get the immune response, our immune cells are able to recognize the pathogen as a foreign invader, and they do two things. Number one, they produce antibodies that will kill that pathogen at that point in time. And then the second thing is they do record information about the pathogen, and they produce some cells that are ready to fight this pathogen if the body encounters it again. So this keeps you defended against any pathogen if you were to get the illness again. Now, herd immunity. Basically, herd immunity states that for as long as a certain percentage of the population is vaccinated, we end up seeing that the disease does not transmit throughout the population. What usually happens is not everyone is able to be immunized because there are some people who have certain illnesses or have a weak immune makeup and thus cannot receive some vaccines. So for those who can get the immunizations, if we immunize them, then the disease itself has the amount of disease in the community is less than what would be expected because most people are immunized. And that in a way also helps protect the people who cannot get the vaccination because there's less chance of them coming into contact with the illness. And that is what we call herd immunity.
Why is it important to receive the recommended vaccines on the recommended schedule?
Of course, it's important to receive these vaccines, just as Dr. Mugaisi was saying, because if you are not receiving them on a recommended schedule, then you have the opportunity to be exposed to that virus. So particularly for children, when they're getting vaccinated throughout their childhood, we are working towards vaccinating them against these diseases that they can encounter later on in life. And so by getting them on the recommended schedule, we are reducing your risk of being exposed to potentially life-threatening illnesses.
Why does my baby get so many vaccines at once? Isn't that too much for my baby?
No, it is not. Of importance, I'd like just to state that we do encounter a lot of pathogens in the environment and in our daily life every day, and the body does produce immune cells and an immune response to fight these pathogens every day. And so the vaccines that the child gets at once would not be as much as the amount of pathogens that the child encounters every day in life. And so it is okay for the child to receive the amount of immunizations, even if it might seem a lot to you at once, the body is able to handle that.
Yeah, that's right. They're only receiving a very small amount, a small fraction of the amount of pathogens that we encounter on an everyday basis. So definitely safe.
What do I do if I miss or my child misses a vaccine in the recommended schedule?
Well, we as healthcare providers, we have a recommended schedule that we try to follow, but we also have a catch-up immunization schedule. So the CDC, which is endorsed by many different companies, give us this recommended schedule that we follow. So if it's missed, we will work on catching you up as soon as possible to lower your risk of getting a possible life-threatening illness in the future.
What are booster shots?
A booster shot is an additional dose of a vaccine that is designed to strengthen your immunity after you had received a previous dose of the vaccine. and there are different types of booster shots. Out of the just regular scheduled vaccines, we do have booster vaccines. Some of these are like the Tdap, which is a tetanus with the diphtheria and pertussis. You could say the HPV, where you receive one initially, and then you will get one after a certain period of time. We have something like the flu vaccine itself, which could also be seen as a booster vaccine. You get that. And some children get it once and they get it after a month. So those are just on a regular routine immunization booster vaccines. There are others that we give for people who travel a lot, the travel vaccines that need booster vaccines. And those are after certain intervals, like 5 years. Examples are like the yellow fever vaccine or the typhoid vaccine, depending on where you're going. But basically what I'm saying is a booster vaccine is a vaccine that is designed to strengthen your immunity after you have received a similar type of vaccination.
Why should I get a flu shot every year?
So building on what Dr. Mugaisi said, so every year our immunity does wane from the flu vaccine. The flu vaccine is only designed to work year to year. Unlike some of the others, the tetanus shot is meant to be in your system for 10 years. Unfortunately, the flu vaccine wanes over a year period. It's also important to get a flu shot every year, not only because your immunity decreases from that vaccine, but also because the actual strains of flu go around differently. Different strains go around every year. Just like this year, we had a very bad season with influenza A, but we've also seen a resurgence in influenza type B. And of course, it is important to get that to be able to catch all those strains. And that is done every year through scientists that develop these vaccines as a prediction of that flu season. So of course, it's important to get that flu vaccine. Usually flu season starts in about October and ends in about March, but it is good to get vaccinated early because it does take about 2 to 4 weeks to get immunity to that. And even if it is late in the year, it's important to still get it because flu is still around like we are seeing this year.
If I'm pregnant, do I need any specific vaccines?
Yes, you do. During pregnancy, we do give vaccines. Specifically, I want to mention the tetanus, the Tdap vaccine. This is given to mothers at 27 to 36 weeks, usually, so you do get that. And then it is also important to get your flu vaccine. You do get a flu vaccine when you're pregnant. So those are the vaccines that we give during pregnancy.
Absolutely.
If I'm going to be near a pregnant person or a newborn, such as my spouse is pregnant, or I will be providing care for a grandchild, do I need any specific vaccines?
Yes, and this is an absolute as well. We want to protect those young babies because they're unable to get all of their vaccines. So as Dr. Mugaisi mentioned, it's definitely important that moms get the Tdap vaccine, but it's also important that caregivers or fathers get that Tdap vaccine to protect their child against pertussis, which is also known as the whooping cough. That has a booster in it. The flu shot is also very important, as Dr. Mugaisi said. There are some other vaccines that are recommended, such as measles, mumps, and rubella, the MMR vaccine. Children are unable to get that MMR vaccine until a little bit later in life. And so it's important that we vaccinate ourselves and that we don't spread that to our children. And other things could include shingles, because of course, if you develop shingles, you can spread chickenpox to that young child, that young infant. And it also is important to have maybe meningitis vaccines and an actual chickenpox vaccine, or know that you have immunity to that, because we don't want to spread that to that fragile infant.
Do I need specific vaccines if I'm going overseas?
Yes, it depends on where exactly you're going, which region of the world you're going, simply because different countries have different requirements. And this is why it is important, first of all, you could consult the embassy for that country to know what type of vaccines that you would need. And we also recommend talking to your primary care physician. And usually what they would do is they would send you to travel medicine setup where some of these vaccines are received. And this can also be received in the health department. Now, some examples of some vaccines that people do need to get if they're traveling overseas include the the yellow fever vaccination, and in some countries they also do require a typhoid vaccine. So it is different for every different region depending on the prevalence of illnesses and what they are trying to prevent. So it is important that you get in touch with the embassy or the country where you're going to travel to, and also with your primary care physician.
I see a lot of commercials and news stories about the shingles vaccine and the pneumococcal vaccine. Do I need those?
Yes, there are populations that need those vaccines. So first I'm going to talk a little bit about the shingles vaccine. So shingles is a painful rash that's actually caused by the virus of chickenpox. Basically, it's going to cause this painful rash that breaks out, and it's more common once you're older than 60 years old. But some insurances and some providers are going to recommend it to you earlier, and it just depends on your medical conditions and, of course, your insurance coverage. But this is a vaccine that is given in order to reduce your risk of having this outbreak of shingles. And a lot of people will ask me, well, maybe I never had chickenpox. They don't remember having chickenpox. But about 99% of people over the age of 40 have had chickenpox, even if you don't remember. It could have been mild enough that you didn't even notice that you had it. So it still is important to get that shingles vaccine. And it's also important, as I mentioned, that if you do have shingles, you actually will spread chickenpox to somebody that's unvaccinated or high risk. You won't spread shingles. So it is still important to have that vaccine. And then that leads me into the pneumonia vaccine. There's two specific pneumonia vaccines that we vaccinate with, and one is called PCV13 and the other is called PPSV23. Each of them have numbers in them representing about how many different pathogens they're going to vaccinate against, because there's many different types of pneumonia. Typically, when we're talking about the adult population, children get them on a set schedule, a certain amount at certain ages. But as an adult, we typically get them if we're high risk as kind of booster shots. But if we're not considered high risk, you're going to get them after the age of 65. You'll get one at age 65 and one a year later as a booster. Because as we age, our immune system can sometimes decrease, and we want to protect ourselves against pneumonia. So they're still very, very important.
Where do I go to get a vaccine?
Well, we give vaccines here at Suffolk Primary Care, Bon Secours. We are located on 148 Barnett's Way.
In Suffolk, and you can definitely call us if you'd like to schedule that appointment. Our phone number is 757-738-1375. We would definitely love to see you. But you can also consult with your own primary care provider, your child's pediatrician, and also the health departments locally will be able to give you any vaccines that you need. But of course, we'd love to see you here.
Thank you both. Anything else to add?
I don't think so.
No. Thank you.